So as I said, next up is gonorrhea, and there it is on the screen. Well, not literally, it's just a word, but so yeah, gonorrhea is caused by another bacteria called Neisseria gonorrhea. Well, it's again very convenient. Um, the signs very similar to chlamydia. So dysuria, purulent discharge from the penis or the vagina. There might be an increase in vaginal discharge, urinary frequency or oliguria, and abnormal menses. If it is left untreated, it can cause PID. And again, we don't like PID because it can lead to things like infertility and even death if it's left untreated. It can also cause blindness if it gets into the eye. So I mentioned that before when I was talking about babies, and how they can get it when they come through the vaginal canal. But gonorrhea is an infection that can occur in other mucous membranes and you can get in the eye. And if it's in the eye and it's not treated, it can cause blindness. So we really, I don't know about y'all, but I like being able to see. Um, I guess it depends on what you're looking at, right? But yeah, we really don't want that. So the diagnosis and treatment. So how we diagnose it is usually just collection from your mucous membranes or secretions, again, same as chlamydia. And then common treatment is just, again, either azithromycin or if it's a really bad case, ceftriaxone injections. But oral azithromycin is the most common treatment. And it works out well because that's the treatment for chlamydia as well. Chlamydia and gonorrhea are pretty common bacterial infections for STIs. They both have the same treatment in most cases. And so we don't have to wait for the cultures. Because, when you take a culture, it takes a couple days to get back. So if we start somebody on oral azithromycin, it's probably going to treat it if we're pretty confident they've got chlamydia or gonorrhea, but we're not sure which one. And then I'm just sprinkling these in throughout because these are pretty short, punchy ones, chlamydia, gonorrhea, and herpes and stuff. This is true again for all antibiotics. We want to encourage them to take the entire treatment. Don't stop taking the treatment when the symptoms go away. Also, try to avoid intercourse through the treatment. And because we don't trust you to avoid intercourse, although we don't tell that to the patient, but tell them that to y'all. We make sure that their partners, if they have a monogamous partner, that they're getting treated as well, because we don't want them to swap it back and forth and get infected as well, or maybe catch it again or something like that. So, again, just a reminder about all that stuff.